Estimates. Well, Dr. Aggrey Morake is the head of department at the Department of Health in Mpumalanga, and he joins us on the line now from Nelspruit. Good afternoon, Doctor, and thank you for your time on the PM News Desk.
Good afternoon, ma'am, and to your listeners as well, good afternoon.
Doctor, in August last year, your department did say that there are only 4 surgeons working in the public sector in the province that has roughly 4 million citizens. Now, we know there's one at the Rob Ferreira Hospital, one at Temba Hospital, and another 2 surgeons work at the Witbank Hospital. Nearly 6 months on, Doctor, how are you addressing the shortage?
We are addressing the shortage through, of course, advertisement as well as engaging other doctors to headhunting, in other words, to come and join the Department of Health in Mpumalanga. But we are also addressing the issue through the issuing of bursaries now for specialists who preferably would be from Mpumalanga, so that we can be able to retain them on completion of their specialization. I must indicate that the department had actually given scholarships previously for postgraduate students in various specialities, but has not been able to retain them as they had left the province to other provinces.
Doctor, what would you say is behind the shortage of specialists at this point?
The shortage of specialists cannot be taken in isolation from the general shortage of skilled personnel in our country from various sectors, whether it be engineers, whether it be teachers, whether it be nurses, etc. But the effort to be able to address that has been ongoing, and it is really that we have to improve also on the relationship between the private and the public sector, so that we may get some few hours from the private sector to assist the private sector as well, since the private sector gets trained, of course, in the public sector.
All right. Recently, health workers have reported shortages of equipment as suppliers are still owed a vast amount of money. I'm talking about equipment, things like wheelchairs, crutches, bandages, orthopaedic implants such as screws, metal plates. All these are used to repair broken bones. How much, Doctor, is owed to suppliers right now? And how many medical supplies are we talking about? 6 months ago, your department said it's reviewing all those outstanding debts and that measures are being put in place to ensure payment. What's the status of that process now, Doctor?
The status currently is that the accruals, which has been money owed to suppliers, had been high in the past year, and we have managed to bring that amount reasonably down, almost below 100 million that was outstanding, and that we continue to pay. However, there are also some of the challenges that had led to such accruals, whereby you find that there is no formal contract between the supplier and the institution or even the department, and as such transactions become irregular because there are variances in terms of cost for the same type of implant from different companies. As a result, we have also now begun to. Actually, we are in the process of finalizing a process of regularizing our contract arrangements with various suppliers, so that it must be easy and correct for the institutions to order from suppliers as per agreement and the costs that have been agreed upon.
Thank you, Doctor, for your time on the PM News Desk. That was Dr. Aggrey Morake, from the Head of Department from the Department of Health in Mpumalanga.